Back to O.M.A Medical Studio. Today, another interesting episode and a topic to discuss. This is a very common thing that has people has been experiencing, and I'm going to be very fast about it. It's not something we should spend much time. But then it is very broad, so you pay attention and then follow. All right. So before we get into it, I would like to address some terms over here so that as we go along, you will get to understand. You don't get confused, especially with those who are not health inclined. All right, so we have some two basic terms here. We call a lesion. Let me say a lesion is basically an abnormal tissue. Let me say a tissue. I mean, way back in SHS, I mean, this is primary JHS and things. We learned about what cells are, tissues, what organs are, organ system, and all of that. Yeah. So we said tissues are what a group of cells that basically perform with similar functions. Yes, so when group of cells come together to perform similar functions, they are called what tissues. When the tissues become abnormal, they are called what lesions. You understand? Also, the tissue that become abnormal becomes also a pathological tissue. So a pathology is basically a damaged tissue. So a damaged tissue is what? Pathological. So when we say there is a pathology in the body or there is a pathology anywhere, basically that means there is a damage. You understand? So you can have a pathological lesion. There can be an abnormal lesion of a tissue that is very pathologic to the site where it is. So there is a lesion which is an abnormal tissue, and that tissue is what pathologic to the body or to the site it is. So I think we all understand this. All right, let's get back to our headaches. Now, headache basically means pain in the head. Pain in the head. This is the head. Pain in the head. Now, to understand these things, basically you need to know that there are vessels that go from the neck into your head to supply your brain. So whenever there is headache, it means that what it is telling you that it is telling you that there is either irritation, stimulation, or agitation of those vessels that are in there. If any of these things happen to the vessels that runs from the neck into your head, you are going to suffer from what? Headache, which means there is going to be a pain in your head. Now, that pain can be categorized into two broad forms. We have the primary and the secondary. This is a very interesting part which I don't want to tackle for the purpose of this discussion. So we come back to this side. So now you've gotten to know that for you to suffer from this, there should be irritation to the vessels that supplies the brain. There should be stimulation. There should be what? Agitation. And anything at all can cause this thing what to happen. All right. So coming back to the secondary headache. Now, so to explain what's the primary headache and the secondary headache, I think I've explained what a pathology and a lesion is. When you experience irritation, stimulations, and agitation to vessels that supply the brain, and you suffer from headache, which has no structural tissue damage, which is a pathology to it, basically means that you are going through what? A primary episode of the headache. You are going through primary headache. It means that there is no pathology to it. There is no pathological damage to any of the tissues in there. So basically, you are going to, there is no structural cause, there is no pathology, there is no cause, there is no abnormal damage to any tissue in the brain or any tissue that is very directly related to what? To the brain or has a connection to the brain. So that means you are going to what? A primary headache. When you come to the secondary headache, it means there is a pathology. There is an abnormal lesion, and the lesion is what? Pathologic. The lesion is causing abnormal irritations to vessels, abnormal stimulations to vessels, abnormal agitation to what? To vessels that supplies the head and the brain. So basically that gives what a pathologic headache is, or a secondary headache is. Alright, so to understand it, what are some of the things that will basically lead to any of these things to happen? That will basically stimulate vessels, that will basically irritate vessels, that will basically agitate vessels that supplies the head and the brain. These sides, now we get to group them under three umbrella or under three categories. We have what you call the mass occupying abnormal tissue, and then non-mass occupying what abnormal what tissue. That's the lesions, and also things that are very external to what to the brain and then the spine. There are a lot of conditions that are very external to the brain and the spine that when it's triggered, or when it becomes abnormal, or when it's infected, it gives you a secondary headache or a pathological what headache. So when we go to, basically the mass is there means it's occupying a space. It's basically putting a lot of weight in your head, a lot of weight on your brain. So it's basically going to irritate the vessels. It's putting a lot of weight. So it's irritating vessels, it's stimulating vessels to work harder than they should. It's agitating the vessels because there's particularly an abnormal trigger to that particular site. So that's what the mass occupying lesion does. Yes, and then the same thing to the non-mass occupying lesion, just that they are not putting pressure, but then they are basically causing abnormal irritation, abnormal stimulations and agitation to the vessels. It can be through infections and then through all kinds of means. And also the external sources can also what lead to the same thing. So when we come to the things that will basically put a lot of pressure on the brain, put a lot of pressure on the head, and also occupy a lot of space, and then going to increase the pressure in your head, the pressure in your brain. Those are what we categorize as the mass occupying lesions. And when you look at the brain, when you look at the head, the whole head, there is the brain there. The brain has vessels to it. The brain has fluid in it. So these three things: the vessels, the fluid, and what the brain itself. These things can lead to can cause a lot of pressure. When there is a damage to any of these things, can cause a lot of pressure and occupy a lot of space in the brain. So let's take the vessels for example. What can happen to the vessels for it to occupy, for it to lead to or probably create a lot of pressure, or probably produce a lot of pressure on the brain? When the vessels rupture, what has happened? It means there is hemorrhage. There is going to be a bleed in the brain. When there is a bleed in the brain, space is going to be occupied, pressure is going to come on the brain, and a lot of abnormalities are going to occur. So basically we have what? Let me use the black so that we can see it clearly. Yes, so when there is a bleed, so it means there is increase in what? In blood, increase in blood levels in the brain. So basically there is a bleed, there is hemorrhage. So there is what you call the subarachnoid hemorrhage, there is what you call epidural hemorrhage, there is what you call the subdural hemorrhage. I mean, these are to people who are clinically inclined, health inclined. I mean, I think you basically understand it easily. Then you go to the CSF, cerebrospinal fluid, that the thing that is cushioning the brain, the thing that is keeping the brain balanced. If there is too much of it, there is going to be what? A lot of space occupied. There's going to be a lot of pressure within your head. So it's going to what? Agitate vessels, it's going to stimulate vessels, and it's going to what? Irritate vessels as well. So when there is increase in CSF, and the last one, I said the brain itself, when there is increase in the brain tissue, the brain cells coming together to form a tissue. When there is increase in the brain tissue, when there is increase in the tissue of something, basically there is an abnormal growth. So there is a tumor. There is a difference between tumor and cancer, though. A tumor can be cancerous. Abnormal growth. So basically, there is an abnormal growth. It has grown beyond its size. So yes. So when there is increase in blood as a result of bleeding, it can be subarachnoid, subdural, or what? Epidural. When there is increase in CSF, hydrocephalus. When there is a tumor in the brain, the commonest one is basically pituitary adenoma. I mean, you are not supposed to keep it. I'm just trying to tell you that secondary headaches that comes as a result of a pathology, which the pathology can lead to irritation of the vessels, stimulation and agitation, basically leading to headache. These are basically some of the causes or the origins of those types of headache you have been going through. I mean, at a point, I'm going to talk about some of the things we see we have to see and recognize that now this is not a primary headache, this is a secondary headache. I mean, that's the last thing we are going to do. But then before that, just get to understand this. Then we have the non-mass occupying lesion, which I said it can come as a result of infections and all of that. They are basically irritations to the tissues of the brain itself. It can be the meninges, it can be the brain um, parenchyma itself. So we have what we call the meningitis. I mean, it's a common infection we have all heard of. We have encephalitis. Then what again can we have? We have the meningitis, we have encephalitis, and we can have what? Blocks in the vessels of the brain, the vessels that supply different parts of the brain. We call it the DVT of the brain. I don't want to bring out the term here, but just know that there can be clots in the tiny vessels of the brain. So we call DVT of the brain. Now let's come to the external side. It's not occurring in the brain. It's external to the brain and then the spinal cord. So infections that can basically extend into the brain from external sources. From external sources, it can get into the brain and lead to what? A pathological headache or a secondary headache. We have what we call the sinusitis. We have the sinuses. Those are more like holes that kind of contain vessels that supply a lot of blood to the various parts of the brain and also to other parts of the body. So the sinuses we have about 4 sinuses. I don't want to get into the names of them, but then I think some of you might know. So when the sinuses become inflamed, sinusitis, and then we have what we call the temporal lobe of the brain, the temporal lobe of the brain, temporal lobe area can also what lead to it. But then let's get into it. And also when you come to the nerves that are directly not connected to, basically external to this to the CNS, the brain and the spinal cord, we have a particular cranial nerve that's like cranial nerve 6 that looks like a hand. Right. Sometimes if you are suffering from that kind of headache, what you feel is that you feel the headache on your face. But if someone should even shout or there is even a very heavy wind towards you, you kind of feel the pain. And that's the kind of headache it will give you. You feel a lot of sensations on your face. That's trigeminal. The nerve there looks like a hand on your face like this. So basically, when there is an irritation to that particular nerve, you suffer from what we call the cranial nerve 6 kind of headache. That's the trigeminal neuralgia. I mean, again, don't try to keep the terms. I'm writing them. Trigeminal neuralgia. It's unilateral, it's just one-sided. Feel the pain and you feel it on your face as well. Then there are some types of headache. Sometimes when you are even combing your hair, you feel that kind of headache. When you are combing your hair, so when someone comes to tell you, if you are a health worker, if you are a clinician, then someone comes, I've been going through this type of I've been having this type of headache. See, to the point when I'm even combing my hair, I feel the pain. And you are looking at what you call the temporal arthritis, headache around the temporal lobe. Temporal arthritis. Yes. So these things are leading to what? Secondary headache. So anytime someone comes with a headache and then you are kind of suspecting it per the presentations, you are kind of suspecting it to be a secondary or pathological headache. These are some of the directions we need to look at. Is it a mass occupying lesion? Is it a non-mass occupying lesion? Is it an external pathology to the CNS? So basically, if it's a mass occupying lesion, you are talking about bleeding. You are thinking about increase in CSF. You are thinking about a tumor. If it's a non-mass occupying lesions, you are thinking about meningitis, encephalitis, etc. So basically, these are some of the few areas or things I can address when it comes to the secondary headache. Now, let's get to the red flags. I mean, this is to everyone. Like I said, basically, when we go here, I specifically said that it's not everyone who is going to be able to keep these things in mind. But at least this ones we are about to talk about, you should keep it in mind. Red flags. Now, just take it like between primary and secondary headaches. The reason why there should be a cause to secondary headaches is that they are pompous, like they are very pompous. When they come, they make you feel like yes, they are in. They have come to disturb you, they have come to distract you. So yes, so we use the word pompous to describe how they come. So let's get there. Yes, pompous. That's how they come. When they come, they make you feel like yes, we are here to disturb you. So let's take the first P. Positional headaches. So someone comes to tell you, I've been experiencing this type of headache. When I lie down, it's very, very severe. And then when I sit up, I get a bit relieved. You are thinking about secondary headache. What can be causing that? It could be a brain tumor. You understand? This could be a brain tumor. Likely a brain tumor. Likely a brain tumor. When I positional headache, when I lie down, the headache is very severe. Sudden, you get a sudden, abrupt, or acute headache that comes very intense. When I lie down, it's very bad. When I sit up, I get a bit relief. You are going to combine all of these things to make sense, not just one of them. Positional headaches. Then the onset. The onset. When onset is abrupt or acute, which is sudden, unexpected. Suddenly, unexpectedly, you experience a type of headache that is worsened when you lie down. You get relief a bit when you sit up. Then you're thinking about this. When it's sudden, unexpected, you should be thinking about. So when you see any of these things, positional, I mean, when the headache is very positional and it's sudden and abrupt, you're basically looking at a secondary headache. Primary headaches do not occur like that. When we get there, we will get to understand. Then when there is a neurological deficit, and someone experiences a very intense, sudden, abrupt positional headache, and basically the person becomes confused. The person can't speak or less speech, incomprehensive speech, just talking anyhow. There's a neurological deficit, or probably the person can, there's a stiff, the person's neck is very stiff, which we can be looking at what? Meningitis. So you basically, when there is neurological deficit, you are basically looking at what? Secondary headache. So secondary headache, whenever you see any of these characteristics in a person's headache, you should be channeling your energy towards secondary headache. Then when the pattern changes, then so you are experiencing sudden abrupt headache. Small time it feels like there is something stabbing you. Another time there is throbbing. Another time it feels like there is this breaking sensations you are feeling. Basically means there is something what causing. So there is this type of headache where people come and then they'll be like, see, I've experienced a lot. I mean, I've been experiencing headaches, but this particular headache I'm going through is basically the worst headache of my life. It gives you something, a thunderclap headache. It comes like a thunder strike. So basically, you know the type of thing you are thinking about. when the pattern changes and there's a thunderclap kind of headache, they come to tell you that there is a worst headache I've experienced in my life, and you are thinking about what? Subarachnoid hemorrhage. There is a bleed in the brain. It comes in association with other symptoms as well, but these are some of the very classical things you hear. The worst headache of my life. There can be papillary edema. We are getting there. Right. Then when there's precipitating factors, precipitating factors. I mean, the common one is Valsalva maneuver. Valsalva maneuver. I mean, this is very simple. When you go to the washroom, when you go to the privacy, and then yeah, you are easing yourself. That kind of strength you use easing yourself, especially when you have constipation. That's what we call Valsalva maneuver. When you are doing that and you are experiencing headache, it's telling you that that type of headache you're experiencing can be what can be as a result of a pathology in your brain. There could be increased intracranial pressure when you're experiencing that type of headache. When you squeeze things out and then you experience a sudden, abrupt, very severe, intense headache, you're basically looking at what? A secondary headache. Then, old age. 70-year-old man comes to tell you that there has no. I mean, they won't even come. They will carry them and bring them. I mean, very intense, severe headache. That was very sudden. You're basically thinking about what? Pathological headache or what? Secondary headache. Then, when the headache comes to systemic symptoms, fever, nausea, vomiting, myalgia. When it comes to systemic symptoms, you know that there's possibly what? A cause. So these are the red flags in directing you that this particular headache this particular person is going through is of secondary origin, but not primary. Like I said, the primary is the most interesting side to me, but today we've shifted away from there and we've spoken about the secondary. In our next episode, we are going to talk about the primary headache. That's the commonest of them all. You have people coming with a lot different descriptions of their headache, and then we will get to understand what primary headaches are, what examples of primary headaches are, the triggers of primary headaches. We will get to understand them in our next episode on what headaches. So now, summary. I spoke about lesions and pathology. Lesions are abnormal tissues, and then pathology is basically a damage to tissues. And I said that for you to experience headache, there are vessels supplying the brain from the neck. The vessels needs to be irritated, stimulated, or agitated abnormally for you to experience a headache. And when it comes to headache, we have two broad categories. We have the primary headaches, the secondary headaches. I said the primary headaches has no pathological cause, but the secondary headaches has a pathological cause. When it comes to the secondary headaches too, it can be grouped under three basic categories. We have the mass occupying lesions leading to secondary headaches, non-mass occupying lesions, and then what external um, conditions or disorders leading to what secondary headaches. When it comes to the mass occupying lesions, I said there can be a bleed in the brain, there can be increase in CSF, there can be increase in brain tissue size. Then also you can have meningitis, encephalitis, you can have DVT of the brain, you can have sinusitis, and you can have what irritations of the facial nerves, which is the trigeminal nerve, and we can have what the covers of the brain, that's the temporal lobe, what arthritis. Then what should point you to any of these things is what we call the red flags that directs you to what? To secondary headaches. So when the headache is positional, when the headache has very acute and abrupt onset, when the headache has in association with it neurological deficit, confusion, slurred speech, stiff neck, then the headache has a pattern. So it's throbbing, one time it's throbbing, another time it's stabbing, another time it feels like a tender clap. Then you are looking at what subarachnoid or hemorrhage bleeding in the brain. Then when it's precipitated by Valsalva maneuver, we are looking at increased intracranial pressure. Also, old age coming with a sudden, abrupt, unexpected what headache. Then we come to what a headache in association with what systemic symptoms, nausea, vomiting, myalgia, all can be traced to secondary or pathological headaches. This is where we bring the discussion to an end.